Hello, I'm Dr. Amit Parasnis. I am Head of Department of Surgical Oncology at Manipal Hospital, Baner. Let us talk about head and neck cancers. Now, head and neck cancers include all cancers which arise from the lips, the tongue, the buccal mucosa, the bone that is the mandible or the maxilla, then the pharynx, the hypopharynx, and the larynx. Now, all these cancers are supposed to be caused by tobacco. Tobacco means either in the form of chewing tobacco or cigarettes or bidis. Apart from that, chronic infections in the mouth, which because of dental infection or dental caries, can also be a cause of cancer. Chronic irritation or chronic injury by a sharp tooth or injury during biting can also be a cause for head and neck cancer. So remember that tobacco is a cause, but all people who do not use tobacco can also have head and neck cancers. These cancers are diagnosed by a biopsy of the ulcer or the region or the wound where the ulcer is situated. After biopsy, they can be staged locally in the form of MRI or CT scan and PET scan. These cancers require wide excision, treatment by wide excision, that is a surgery which includes removal of the entire ulcer along with a margin of normal tissue from around the tumor, and if required, removal of the bone and the skin and the teeth also. Now, this particular surgery will cause some amount of disfiguration, which will cause a permanent impairment in speech, swallowing, function, and appearance of the patient. Now, a part of this can be repaired by doing reconstruction with the help of local or loco-regional flaps or free flaps. Local flaps means rotation of local tissues to actually cover the defect which has been caused by removal of organs. Loco-regional flaps can be from the shoulder or from the chest wall, taking tissue from there and using it to reconstruct the portion which has been removed. Nowadays, we can do the reconstruction, even bony reconstruction, with the help of free flaps, that is taking a bone from the foot or taking some tissue from the hand and taking it along with its blood vessels and suturing or anastomosing those blood vessels with blood vessels in the neck. So this is called as a free flap. With free flap, you have a better variety of skin or bone available and better length and better size available. So with all these reconstructive techniques, the physical disability and the cosmesis can be improved. All head and neck cancer patients, or most of them at least, require additional radiotherapy for keeping the disease in control. This radiotherapy is given after around a month or a few weeks after recovery from surgery. Radiation has its own side effects, but it is important to take this radiation. The side effects can be minimized with the help of latest techniques, and once a wide excision and radiation is taken, the chances of maximum disease control are possible and even cure is possible. So remember the advice of your doctors. Proper treatment needs to be taken. After treatment is finished, there can be rehabilitation in the form of physiotherapy for movements, physiotherapy for speech, and physiotherapy for improving the swallowing also. So with all these techniques, better cosmesis, better function, and cure of head and neck cancer is possible. Thank you very much.